That's all for the meditation. Gently open your eyes. It is 10:40 now. We'll be starting with our webinar. My screen is visible now? Good.
Yes, sir.
Yeah. So we'll pray to Almighty God and the Master, Dr. Hanimal, Samuel Christian Frederick Hanimal. And first we'll start with aphorism 4, which says, he is likewise a preserver of health if he knows the thing that derange health and cause disease and how to remove them from the person in health. From Organon of Medicine, 6th edition by Samuel Hanimal. Aphorism 4. Now aphorism 5, which is very important aphorism for any physician. Useful to the physician, yeah. Useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease, as also the most significant points in the whole history of a chronic disease, to enable him to discover its fundamental cause, which is generally due to chronic miasm. Fundamental cause, which is generally due to a chronic miasm. This is very important in chronic case taking, right? In this investigation, ascertainable physical constitution of the patient. What Hahnemann says, ascertainable physical constitution. He writes in the first part itself, especially when the disease is chronic. His moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual function, etc. are to be taken into consideration. Organon of Medicine, 6th edition. These are 2 aphorisms you should read daily before starting practice, and that will help you to enrich your practice, because Organon is one of the pillars. First is Organon, second is Materia Medica, and third is Repertory. So we'll start with a very nice case, that is case 1. It was a very nice case of a sterility. It is a case of a lady aged 37 years of age, came for problem of sterility with lot of anxiety about career. So as you know, ladies are now, lot of anxiety about careers. So the first question I asked, what is your problem? She said, I have a lot of confusion of mind related to whether I would conceive or not. I feel I am responsible for my condition. See what he says, no? So when what kind of word the patient use is very important. What is the present state or a scenario which is going in her mind, that determines the main selection of the remedy. Few minutes of the case taking is very, 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 very important to understand the dynamism or the dynamics of the case taking. And case taking, as you know, Organon is 83 to 104, right? So I'll repeat her what she said. I have a lot of confusion related to whether I would conceive or not. I feel I am responsible for my condition. Very important again. As only delayed my pregnancy. As I wanted a good career in my life. And she reproached. That was my observation she did at that time. She used some word because it is a very detailed case taking, but I've cut short. And for that, I am not able to describe my problem in detail. and there was a big pause. Because of the confusion, she was not able to describe her situation or a condition where she was in a dilemma where she can be conceived or not. Pregnancy was a big issue, and for that, she has a big tension, right? So I have tension whether this problem would be solved or not. So there was a big question mark on her face. So the second question was, tell me about your nature. I want lot of change in my life. Nowadays, the people say lot of change because of the tuberculosis. The people would say, change I want. Two drugs that you should remember change in life is Senicula and Vaseline. They need lot of change. All tubercular drugs and all plant kingdoms who has the tubercular myzem in them, the state of tubercular.
એવું છે ને બધા જ કન્સેપ્ટને સમજો. આ વિજય કર્માએ જાય ને
I want lot of change in my life, not like monotonous life. घिसी-पिटी वही life. What she said in Hindi is घिसी-पिटी. रोज सुबह उठना, खाना बनाना, उठना, टिफिन बनाना, रोज खाना बनाना, टिफिन बनाना और जॉब पे जाना, बच्चों को खिलाना, और मैं बोर हो जाती. क्या हो जाते हो? बोर हो जाते. That is what she said in the second part of the case. Now the third question. What else do you like to do in life? These are the few questions you should ask in general. So I like to play with small babies. See, very interestingly she said, no, I like to play with small babies. When I see others' baby, I think, why God has not given me a baby? See how, no, how deep the feeling and emotion she has in her mind. Sometimes I feel my husband is responsible for my condition. So she blames, no? So blaming comes. She has some sexual issues, but he is not going to doctors for that. That happens, no? The partners depend, no, they blame each other. He doesn't go to the doctor. He sends me to the doctor. That is this lady is feeling at this moment. So the dynamic of the case you have to see in each word the patient use. It is very, very important. Now, what is the feeling for that? When husband is not going to the doctor. Now, this is very important question you should ask the patient. What is the feeling when that your husband is not going to the doctor? I feel that if he would told me that he had issue with that, I would have not married to this man only. समझ में आया? पहले ही बोल दिया होता तो ये गड़बड़ होता ही नहीं. पहले उसने कुछ नहीं बोला और दूसरी बार तो ये जाता भी नहीं है डॉक्टर के पास. और मेरी लाइफ कैसी है? घिसी पिटी है. She is totally bored and the problem is sterility. This dynamic is very important, dear students and my colleagues. Now, another question, what is the inner experience of this situation? I felt that he had cheated me. My God, what she said, he cheated me. And he did not clear this.
Yes.
Also, he was not getting any girls. मतलब उसने बहुत सारी गर्ल्स देखी थी, उसको नहीं मिल रही थी, तो उसने क्या बोला, यही है तो चलो चला ले. That happens, no? And that's why he did not say clearly this to me. Are you understanding? अभी उसको बहुत सारी लड़कियां तो उसने देखी थी, पर अभी ये मिल गए, चलो ना उससे शादी कर देते हैं. So issue about the sexual function was not being clear to that girl, which is our patient. Clear? Till now clear? Say yes, online. Anyone, Nitin?
Yes, sir.
Thank you so much. So what is that feeling? I would like to share one thing that in our community, girls are less. So to find good girls, it is very difficult. And for that, if they would tell the truth about this man, the marriage would not have been possible. ठीक है ना? अगर वो बोल दिया होता तो शादी नहीं होती ना उसकी. So that was the main issue that she was, no, that's the feeling that she was having, being cheated. Another bypass question, which is how was your childhood? So she said it was very good. I was cared well by my parents. Anything else you would like to share? Any specific detail about your nature during childhood? This is also a good question you should ask to the patient. Event incident attached to the childhood. These questions will make you go through the inner core of the patient or the inner pattern of the patient. It is required in some of the chronic case taking, not in all the case taking. Every case is a different world we are entering in. There are short case taking, there are detailed case taking. After that, I have almost 7-8 cases which are very short. This is one of the biggest case or the detailed case. Anything else you would like to share? Any specific detail about your nature during childhood? Yes, doctor, very important. I am the only issue of parent. But when parents used to quarrel between them, I was so disturbed and used to calm them. ठंडा कर देती थी मैं दोनों को. This is very important. Again मैं ये पढ़ता हूँ. I am the only issue of my parent, but when my parent used to quarrel between them, I was so disturbed. I used to calm them. ठंडा कर देती. That was the technique she used to do. So each sentence what the patient speaks, we have a rubric. So after completing this case, you have to find the rubric. You have to write it down and you have to find the rubric. So that will be the work that I am giving you. एक एक part आप लिखना है. Dear student, are you listening? एक एक part. You have to find the rubric of the case. Till now, what are the rubrics? I'll give you 10 seconds. अभी तक का rubric आप लिख सकते हो. लिखो. 10 seconds I am giving you. Till now, what are the rubrics that you got? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can repetize with your mobile repertory or anything, whatever you want. If you have a canned, complete, anything you want. Because this case taught me a very nice single remedy that was really blew me up. Superb case taking and a superb remedy. Okay. Ready? कितने मिले? एटलीस्ट 1-2 तो मिले रूब्रिक. अभी तक के मिले? 2 मिले ना. बहुत हो गया. अभी तक तो ऑलमोस्ट 3-4 हो जाने चाहिए. चलो, let's move forward. What was the effect? If my parent used to quarrel, I used to be disturbed. That used to be disturbing for me. I calmed them easily. That was the effect. And then I asked her anything else. She said, when I grew up, if somebody said any sad things about others or about any girl where in-laws have left them, I used to cry a lot. मतलब अगर उसके आजू बाजू इन-लॉज के बारे में बोले या कुछ खराब sad things या no, if they are saying no, she gets so much disturbed. This is also very important dynamics of this case. There is a rubric there itself. Find rubric at that time. What I did in this case was every sentence had one rubric. So quickly you have to find a rubric of each emotional dynamism. I used to cry a lot and used to blame his bhagya of hers at in-laws प्लेस, मतलब कैसा भाग्य है उसका, इन लॉज में उसको क्या हो गया देखो तो. एंड शी यूज्ड टू फील सो सैड. What is the situation? She was so mournful. There is one rubric called mournful. Mourn. Mournful. Anything else? I like to go to hilly place, plant saplings, watch bird flying, and their desire to live at my village. Leaving all this janjat of life. See, she wants to escape with the situation, or she has a habit or hobby of to go to a hilly place where she loves all six scenes, and there is a rubric there. So find rubric at that place also. Again, I'm giving you a few seconds to find the rubric. What is the rubric at that part? Then, can you please tell me the essence of your life? This is good question, no? Essence of your life. मेरी स्थिति एक दयनीय स्थिति है. एक स्त्री जो सारा दिन काम करती है, जो अच्छा रखती है सबको, बच्चे को, और उसको धोखा ही मिलता है. दिस इज वेरी इंपॉर्टेंट, नो? जो स्त्री सबको संभालती है उसको एंड में क्या मिलता है? धोखा. चीटिंग, नो? चीटेड, बिट्रेड, चीटेड संबंधों में, इन द रिलेशनशिप. सो शी इज वेरी सेंसिटिव. सो sensitivity comes from the plant kingdom, and sensitivity to relation is mineral. She can be a plant, she can be a mineral. You have to find the rubric. Now, this is the last part of the case where she will tell you very, very important what she is telling. Now, this is my favorite question that I ask to my patient is, tell me about your daily schedule. And in this daily schedule, no, everything comes out. सब कुछ नहीं पूछने, खाली डेली शेड्यूल पूछो बस, पूरा चिट्टा बाहर आ जाता. कुछ पूछने की जरूरत ही नहीं. I get up early in the morning and do a lot of cleaning activities. And because of that, I have a lot of pain. And she said, अटक जाती है मुंडी सुबह को. This is मुंडी which is अटक जाती. This is very important. Huh? Again, अटक जाना मुंडी. Many of our patients will say, मुंडी अटक जाती, क्योंकि हम एसी में सोते हैं और स्टिफनेस आ जाती है. इसी के वजह से मुझे काम करने में दिक्कत होती है. अब सुबह ही अटक जाओगे तो कैसे काम होगा? देवांशी, होगा? नहीं होगा, क्योंकि सुबह से ही वही, अभी मुझे क्या करना है, घर, लेडीज, होम, हाउस वाइफ, नो, सो दे हैव टू चेक आउट ऑल द प्लान्स ऑफ द लाइफ. सुबह उठ के यही थिंकिंग अबाउट डोमेस्टिक अफेयर्स. पल्सिटी इज वेरी इंपॉर्टेंट इन बोनिंगसन व्हाट ही सेड. सुबह जब आंख खुलती है तभी वो डोमेस्टिक अफेयर्स के बारे में सोचती है ना. There is another drug, small drug, that is Carlsbad, where she has some anxiety about domestic affairs. और मैं रुकावट महसूस करती हूँ काम करने में. That is very, very important. So that is the रुकावट. What is रुकावट in obstacle? Any other word for रुकावट? सोच लेना. Restricted. Very good. Any other word? Any other word, beta? Online.
हिंडर.
रुकावट. Good. Good. Superb. Nice. Congratulations. Those who have said hinder. काम वाली नहीं रखती हूं मैं. झाड़ू अपने आप लगाती हूँ. Now this झाड़ू खुद लगाना, this is very important of many ladies. I have seen in Baroda. काम वाली का अच्छा नहीं लगता. मैं खुद जब तक काम नहीं करती हूँ तब तक मुझे अच्छा है. These are all real dynamics that you will see in the case. And from that we have to find the remedy of. अंगूठा और मेरा कांडा है ना, कांडा, दिस इज द रिस्ट, दर्द करता है. दैट इज वेरी, वेरी इंपॉर्टेंट. अगेन, There is a remedy there. What is the diagnosis of this pain at the thumb part? Can you tell me? The
Spongia.
radiating pain. Yes, what?
Spongia.